when one organ dysfunctions, it affects the rest of the organs. So if my liver is dysfunctioning, it's going to affect my lungs. It's going to affect my heart. It's going to affect my adrenals. It's going to affect my large intestine. So if I just fix my liver and I don't restore all of these functions, what's going to happen? What's going to happen is eventually this is going to start reversing. That's what happens with corrective care, right? This is corrective. If you don't want that to happen, then that's where you go restorative care. Restorative care continues after corrective care, and then it gets you towards optimal health. It starts focusing on restoring your lungs, restoring your heart, your adrenals, your large intestine, your small intestine, your pituitary, pituitary. I think I'm spelling this wrong. Okay, it restores your spleen, your thymus. That's what restorative care.